Buenos dias, saludos a todos. My name is Taylor Bryan Turner, Assistant Regional Administrator for SAMHSA New England in Region 1. It is my pleasure to welcome you to the DIPS model in honor of Hispanic Heritage Month. The Diversity Inclusion Project Showcase is an opportunity to recognize community-based organizations for their life-saving work in community. We know you change lives for the better, and we want your efforts to be known to as many partners in state and federal government as possible. At SAMHSA, our mission is to reduce the impact of substances in communities and promote mental health and wellness. Our top priorities are preventing overdose, enhancing access to suicide prevention and crisis care, promoting children and youth behavioral health, integrating primary and behavioral health care together, and using and promoting evidence-based practices. But throughout those goals, there are 4 guiding principles, and within them are workforce, recovery, equity, and finance. We know, we now have an Office of Recovery for the first time ever, led by Paolo Del Vecchio, who is a light and walks the talk and represents people in recovery. And DC hosted a powerful, diverse Recovery Now Summit, where Latinx leaders led and contributed to new policies. But we need more of you leading at the national levels. We know that funding streams can be challenging to maneuver, yet your work continues and your client needs also continue to grow, right? We have the data that shows that our Black, Indigenous, and Latinx communities are hardest hit when there is a pandemic, when there is an epidemic, yet we remain underfunded. Blacks and Latinos have substantially lower access to mental health and substance use treatment services. You know the numbers, about 90% of 2.4 million people with an SUD did not get treatment, and about 67% that had a mental illness did not get treatment. We know that you are serving the folks who need you more than ever. And DIPS is a way for you to showcase your needs as well as your wins. And we do this by honoring CBO voices and providing a platform where they can be heard, seen, and supported. It is an initiative that aims to connect a more diverse pool of applicants for grant funding opportunities that stem from federal and state funding, philanthropy, organizations, and foundations, and universities. We want as many nonprofit organizations to present. We want our federal and state partners to be there and learn about your work so that when funding is available, you are not an afterthought, yet you are at the forefront of their minds. We want you to begin building your network with your state behavioral health leaders all year round so that you are available for referrals as well as partnerships, right? I learned recently that partnerships and partnering are different, and we want to make sure that you are absolutely partnering. So DIPS can be held virtually or in person, and we hope to be in person one day. DIPS can have a broad focus or a real dedicated one, dedicated to, say, youth, housing, women and maternity, LGBTQIA+, reentry. But today we are highlighting Latinx communities in motion. Please network with each other while you're here. Build those relationships all year round. So when funding is available, those seeds have already been planted. We also want you to have training from our national network to eliminate disparities, our Elevate CBOs, our other technical and assistance training centers, so you always feel supported. Your very own New England Mental Health Technology Transfer Center has its own REACH initiative, Racial Equity and Advancing Cultural Humility for Organizational Change. It's a learning collaborative, armed with evidence-based practices as well as self-care tips and tools to maintain your health and strengthen your resiliency as well. So please join REACH. I hope you learn about it more later on today. If you want more examples on the DIPS that we've held, please visit our website at samhsa.gov/DIPS. Know that DIPS are here meant to elevate you, make sure that your mission is heard, and that all of our beautiful people are seen, as well as prepared and at the table for opportunity, because the work you do is invaluable. So we thank you, we celebrate you. Muchas gracias, que se deriva y disfrute. And now I'd like to turn it over to Maria Restrepo-Toro.
You're muted, Maria.
Buenos días.
Welcome, bienvenido. Gracias, Taylor. It is such an honor to be here as a Latina working in this field, dedicated the field all my life to have you all here today. So as you know, my name is Maria Restrepo Toro. I'm sorry, you may not know that. I am the co-director of the New England Mental Health Technology Transfer Center. There are centers around the country. In our region, we're very proud to explicitly concentrate on recovery-oriented care and really engaging all communities of colors, especially that Latinx communities, and that includes both Spanish-speaking and Portuguese-speaking. So here, as Taylor mentioned, we are an intentional, cultural responsive organization, and we are committed to achieving health equity for everybody in every single state in the New England region. And for this effort, because we know sometimes it is really hard to reach, but especially in New England, Latino communities are represented in every single step. So if you know there are Latinos in your state and still need ways to help us engage, we welcome you today, because you're going to be hearing about some amazing work from community-based organizations already doing that kind of work. And we want you to know that why this is an urgency, because we are the largest group in the United States. Taylor referred to the disparities, the treatment, the language barriers, the lack of cultural services. The disparities are huge. And if you see here, this is just represented in New England. They may be concentrating in urban centers like Boston, Connecticut, Rhode Island, but they are in all the states, because some of the northern states also work with Farmers Latino, which we're going to be hearing about today. So we are here to support you in this outreach throughout our region. Why this Latino celebration is so important, again, because in our strategic initiative, we are really designed to really do a strategic outreach to strengthen all the efforts in the communities of color consistently in a practical way. So today is an example of this fabulous program that we are hosting for funders to really be able to really hear the amazing work community-based organizations are doing. In addition to our region, we have amazing partnerships with National and Latino Mental Health TTC. We will provide that because there's amazing resources in Spanish and Portuguese, and also the Caribbean. In fact, this afternoon, we are doing another workshop that we invite you to attend. Let's concretely hear a little bit about the Spanish speaking and Latino. So I'm going to turn it to my colleague and really my partner in the Latino initiatives, not only here, but also at the Yale Recovery Colectivo, Graciela Ruiz.
Hello, everybody. Good morning. So it's my pleasure to be here with you today. We are here today to celebrate culture, to celebrate yourselves, our history, and everything that you have active on living in this country. For the last 4 years, the MATCC's Caribbean, Northwest Caribbean, National Hispanic and Latino in New England start to work in collaboration to develop resources that really respond for the needs of Latino and Hispanic community living here in the United States, more specifically in the mental health, talking about recovery. Our goal started 4 years ago when you decide to use a participatory component and talk to people, talk to providers, talk to families, talk to people who had lived experience in mental illness, and build it together, inspiring by them and listening to them, a couple of resources. Today, I want to share with you the Walking in Recovery. So this is a result of one of these community-based participatory research and in communication with them. we collect information and you produce these cards. These cards are available in English, Spanish, and Portuguese. And the message that we are sending, our goal in doing that, it's really to normalize the conversation about mental health for this community and engage them with providers at school, at the community, is really to engage in a conversation and have these cards as a tool to offer an opportunity for those who doesn't speak English, can talk about your mental illness, can talk about your trauma, can talk about your life using these recovery resources and strategies to talk about themselves. So I would let you know these cards, it's available. We will find them looking at our website. I will also share the cards here. I'm asking you to please use this tool. Don't hesitate to contact us, and let's celebrate life, community together. Thank you.
Thank you, Gracie. And if you see, every detail on this amazing cards in 3 languages are all to promote and reduce the stigma of mental health recovery. So now is the reason we're here today. It is our honor to present you 3 amazing community-based organizations within our region. As we know, Taylor explained, the DIPS model is really designed to highlight you and elevate you and connect community-based organizations to funders at all levels. It is very important that you learn, because these programs you're going to hear about, you're going to hear about their stories and the different resources. We're going to hear from Rhode Island, we're going to hear from Maine, and Massachusetts as well. So it is my honor to introduce the first showcase speaker. It is Eloisa Maria Galvan. She is the executive director of the Brazilian Women Group here in Massachusetts. She is dedicated her life to empower immigrant women through education, health, financial independence, voter registration, community organization, and advocating for change. Remember, the Portuguese-speaking communities are also Latino, Hispanic, Latinx. So this is why we're also celebrating the Brazilian community work. So Eloisa, bienvenida. You can unmute yourself. Eloisa, we're not hearing you. You have to mute yourself.
Sorry.
There we go.
It is a good morning to all. It is a privilege and an honor to be here and have the opportunity to share with you a little bit about the Brazilian Women's Group. We are a 27 years old community organization. We started back in 1995, not as an organization. We started as a group of women that wanted to talk about their experience being Brazilian, being women, and being an immigrant in this area. At the time, we already have a large Brazilian community here, but we didn't have the level of organization and the number of organizations that we have now at this point. The Brazilian community of Massachusetts consider, some people say the first, some people say the second after Florida, largest Brazilian community. What I can tell you is that this community is very diverse. In the beginning, a lot of the young couples, or the man alone or the woman alone came, some with very small children, over the past years. And this started in the middle 80s, when inflation in Brazil was totally out of control. Over the years, this profile changed a little bit, because now we have people coming from all over. Before it was mostly from the state of Minas Gerais. But now we have people coming, the last years, 10 years or so, we have people come from all over Brazil. And we have all ages, we have all colors, we have people from all, paths of life. And also what we see in the community is that there is a diversity of people. We have a large population of students, graduate and undergrad, that goes to college here. We have people who come because they want to learn English and improve their prospect of professional prospect. And we have this community. That's where with whom the Brazilian Women's Group work. The community, people who come because they are frightened in Brazil, because they can't make a living in Brazil, and mainly because they believe here, the United States is the solution for their lives. Of course, we know that's not true, unfortunately, but they are sold by the coyotes back in Brazil that, they're going to get paper, they can turn them over to immigration, everything will be okay, they're going to get social security, they're going to get permit to work, and not like that. But this is the latest, but we do have people who came a long time ago, 30 years, 40 years ago, that are citizens that vote both here and in Brazil. And now we do have indeed people going into politics, which is a first for us. So in the last 5 years, we have 5 or 6 people that are applying, are running for candidates. So in January, we're gonna have 2 women and 1 man at the State House, because they ran the primaries and they don't have competition. So they'll be elected on November 8th, and they'll be at the State House. We also have city councils in Everett, which is a community that Brazilians, the presence of Brazilians is growing. And we have in Framingham too, and Brockton. So this is changing the perception of Brazilians in this state and in this area, because years ago, Brazilians were taken as undocumented and invisible. No more. Brazilians, Brazilians are the second largest group in naturalization ceremonies. But because we have a very short time to present, I really want to say that the Brazilian Women's Group is here to mainly empower women. We want our community to have its own voice. We don't want to take anybody by the hands and do things for them. No, we want them to know that regardless of how they got here, I don't care if you came first class or swimming, crossing the border, you are a human being. You have rights, and you should exercise your rights. Of course, you have your duties too, but you have rights. And you should not feel, because this happened with Brazilians, they feel guilt that they are here, that they send their kids to school, they get free meals, and they don't have documents. And I always tell them, no, you may not have some documents, but you do pay taxes. Not only you file income tax, but you pay tax in everything that you buy. And we know that immigrants tend to spend more than the native people, or native people would be the indigenous people, but people who were born here, who live here, who has had their lives all the time here. We have several programs, from immigration advocacy to workers' rights, civic engagement. We now, since the pandemic started, we are working aggressively on COVID education. We have done, I don't know how many vaccination clinics. Because when the vaccine was available, we advocated for having clinics, for hosting clinics, because we said our community is not going to get the vaccine. Also because the process to get the vaccine, to apply for it, was very complicated, but also because people wanted to know, wanted an ID, people wanted insurance, And we said, our community is not going by that. You know, we have to offer free and no documents, no questions asked. The only thing that you need is your arm to get the vaccine. And we have vaccinated hundreds of people. We did last year with this group that we are part, that is called Equity Now and Beyond. We vaccinated over 6,000 people, and we are 4 organizations. So the most important thing that I need you to know, because I think I have 1 or 2 minutes, is that we're here to stay, or maybe some people are going to go back, but organizations like the Brazilian Women's Group, and we have other organizations that work with the Brazilians, but organizations like the Brazilian Women's Group, we live in the community. We have gone through the same experience that many immigrants. And what's important to know is that we really worked with, I don't know, maybe over 70 organizations in order to do our work, but we need your support. We need the support of other organizations that are larger than we are. We need the support of funders. We need the support of other community. We need our community to be with us side by side so we can do the work that we do. So by saying goodbye, I just want to thank you again for having this space. And I really feel that, you know, we have grown our voice in the last years. Thank you.
Eloisa, thank you. And as we want you to network, and if you know, I think what she said that may take on, we are here to stay. So please reach out to all of us, and especially to Eloisa. So now I have the honor to introduce, we're moving to Rhode Island now. Winston Delgado Ortegano is a community health worker at Latino Progreso. Their agency is in Rhode Island, helping immigrant communities to achieve self-sufficient socioeconomic progress by providing transformations that support personal growth and change. Winston, their agency is located in Central Falls, that happens to be the best Colombian food in New England. So if you ever want to go and eat good Colombian food, contact Winston. So Winston, the floor is yours. I will advance the slides.
Thank you, Maria. Thank you, Paul. Hello, everyone. My name is Winston. Like Maria said, I'm a community health worker for Road to Equity, Progreso Latino. And I'm very happy to announce my organization, and I'm feel very support right now because I can see, you know, my team is here and it support me because it's my first time doing that. So I'm very happy. So yeah, Maria, next slide, please. So Progreso Latino, who we are. Progreso Latino was founded in 1977 to serve Rhode Island Latino and immigrant community. So we are located in Central Falls, Rhode Island, 1 square mile, immigrant town of over 19,000 people, 60% of constituent are Latino. Local Hispanic leaders saw that the state existing infrastructure did not adequately meet the needs of the rapidly growing Latino population and form a multicultural, multi-service and agency with a vision to help build a stronger, more self-sufficient community. We aim to drive social justice forward with a mission to develop transformational programs that assist individuals and achieve their life and civic goals. Next one, please. So this is the good part. So I'm gonna just very quick to announce that we offer a Progreso Latino. So we provide food assistance. We have a program for adult education where we serve job program, domestic violence, job training, preschool, school ed program, health and wellness, immigration support, vital service, and social service. So like I say, that we offer service from early childhood to elder adulthood. You know, so we can help people and to find solution to our community. Next one. So, wow, adult education. I think this is my best program. On adult education, we offer GED. We can help people to complete the citizenship. We also do ESOL, English as a second language with Minanfield. I'm very happy because I'm part of that program. And we offer Bridge to Career. Bridge to Career, and I will, like to talk later. Bridge to Career helped me to connect with Progreso Latino because I complete mental health first aid training, and we offer also a computer literacy. So next one, please. So we offer a job club. We do weekly job fair, and we can help to Latino or any people to come here and build the resume, and we can provide industry training and certification. It's really easy. It's just to send a text, and then we can, connect with company or organization are looking people, to get a job, and we can help to build the resume and how come, like when you go to do an interview. Next one, please. So we have immigration service. Service Progreso tend to be more successful due to cost, trust, and proximity. So you can see sometimes people get confused because we can offer legal service, but we can provide immigration service, which is citizenship petition, representation and interview, notary service, DACA renewal, work authorization, TPS renewal, advanced paroles, visa extension, and general consultation. Next one, please. So on social service, the program help individual identify and access service and research and advocate of their behalf when systems are not responsive. This part sometimes for the community is really hard to understand, but yeah, we are here to help and complete any application, which means for housing program or SNAP or Medicaid, refill or food pantry, etc. Next one, please. So we have a food pantry every Wednesday from 10 a.m. and 1 p.m. You can join us as a volunteer if you want. We serve nearly 1,000 families per month, and in that moment, yeah, any organization come, and also Progreso, we can go there to complete any outreach and community research. That was one of the part of my job that I'm doing now. So health and wellness department, we help people for promote health education. We service senior program and wellness screening, free clinic, and insurer enrollment. We can do COVID-19 support and research. Next one, please. So now there is people that sometimes they don't know what exactly do a community health worker or promotor de salud. So what exactly a community health worker do? So we do outreach. We look numbers. We can, take a moment with the community, what exactly they are looking for. We do community education. We do case management and care coordination. We help promotion. We informal counseling, and we support. We do social support and advocacy. Next one. So this is a quick story about me. When I come here to Rhode Island, I'm born and raised Venezuela, and then in 2013 I moved to Miami. So there I'm just be growing as an independent contractor, and then I'm just get opportunity to come on Rhode Island on 2020. But as you know, in 2020 that was the terrible situation for COVID-19, And, the business was getting, kind of low. And then I'm just, looking at websites in Progreso that was closed for the COVID-19. And I found the website here at Progreso. And I found a really good program about mental health first aid that I was just, send a text and see what happened the next step. So I don't remember how many times, spent to that I can join to the program. But yeah, they send me the information. And now, I mean, when I come here the first time, I met amazing people here. And now, yeah, the next one, please. So this is my job right now. I start here as a student. I start here with any concern about me, about my language barrier. I feel that I'm still, practicing learning. But I'm very happy that Progreso Latino give me the opportunity to growing as a person and now as a professional. It's really nice when people come here with any concern and then they just leave at the door with a big smile. And I think this is really happy. And I'm very happy to now say that I'm a community health worker at Progreso Latino, and I'm creating connections between Progreso Latino and community. So if you feel that you are doing this, with love and passion, I think that you can be a good community health worker. So thank you.
Wow. Felicitaciones, Winston. This is your story of the power, and congratulations to Progreso Latino. Beautifully told what it means to believe in somebody else, to provide hope and opportunities. So please contact Progreso Latino and any of us, Weston Delgado, and we will be happy to network you and connect you with you. And we hope we continue this journey together, Winston. It's been a pleasure. Gracias.
Thank you, Maria. Can I say something really quick?
Okay, just one more. Yep.
Yeah, we made the arepa.
Okay. Okay, I'm going to have arepas with you. Okay, that is a plan.
Thank you, Maria.
Gracias, Winston. There is a little bit competition between Colombian arepas and Venezuelan arepas, so that is where this is coming from. But now we move up to Maine, and it is our honor to present our featured speaker today from the Maine Mobile Health Program. Laura Valienza Orozco, she is the Behavioral Health Director, and she is dedicated to improve the health status of Maine seasonal workers and their family by providing culturally appropriate services, which the majority of them are Latino farmers. And you are going to see that Laura's work location is the most amazing. So Laura, I am not going to spoil the surprise, but please, bienvenida, Laura. Adelante.
Hello, good morning. Buenos dias. Thank you so much for having me today, for inviting me to this. I work for Maine Mobile Health Program, as Maria said, and I'm the Director of Behavioral Health. Today, I am inviting you into my workspace, into my office. And so I'll tell you a little bit about who we are and what we do, and why I am in a vehicle right now. So we are an all mobile federally qualified health center. And right now I'm gonna focus on access to behavioral health services, but we are more than behavioral health services. We're a health center. We offer primary care, integrated behavioral health, limited vision and dental, and care coordination. And care coordination, I put care coordination and system navigation because they really go together. So that means making appointments for patients, providing the transportation, providing the interpretation, providing advocacy, and also paying for those services when they're not provided in our mobile clinics per se. So there's a lot more to be said, but I just wanted to give you a quick synopsis of who Maine Mobile is. I was really amazed when I looked at the map of New England and I looked at Maine as being kind of the bigger state compare in terms of the large area. So we provide services across the state of Maine. We travel all the way from Presque Isle to Portland, and we have patients all across. And here's just a quick synopsis of where our patients are located. They really are picking all our berries, all of our fruit, vegetables, eggs, wreaths. When you see the wreaths across America, all of those wreaths are coming from our patients down east. And I think that when we see that, a lot of our patients are not represented. So when we talk about voice representation, that's really what needs to happen. The majority of our patients are male, or all the migrant farm workers are male, although we do have some families that come up for blueberries. Our seasonal farm workers are patients that work here year round or work seasonally, but they mostly live in Maine, and they're more like dairy, poultry, aquaculture. We also provide services to seafood processors across the Maine. The vast majority of our patients are uninsured, and so that's where we come from, because we provide the services in our mobile clinics, but we also pay for our patients to access services in other clinics. The majority of our patients are below the poverty line. 99% of our patients are below the poverty line. About 66% of our patients come from Mexico, Central America, like Salvador, Honduras, Guatemala, although we are starting to see a trend of Venezuelans and people from Colombia. This is my first year where I'm starting to see that. So it'll be interesting to see how the numbers continue to evolve over the years. Next. So here is a picture of our main. This is what we call it. We call it the Carol. It's our largest mobile unit. It has 2 medical exam rooms. And so it looks, when you walk in, there's 2 rooms on each end. One on each end, and it looks just like a medical office. In the middle, there is a behavioral health room, and that's where I can see patients in person, or I can see them on the minivan where I am currently sitting. And we put usually the intake workers or community health workers, which are really the backbone of our work. They usually do intake and registration outside the mobile unit, or intense, because we provide also COVID supports. So our behavioral health providers are present at most clinics. So we travel across the state of Maine to be in all of the clinics. And this is to provide services, but also to increase awareness to mental health, because there's such huge stigma with mental health among our Latinx communities, and not just our Latinx communities, the other communities where we provide services. So we want to be there. We want to talk about it. We offer an appointment with our behavioral health providers. Each time that they come, they get offered. They can say no if they want to, but it's part of normalizing behavioral health and access to mental health. And all of those services are free when they come in. Their patients are screened for depression, domestic violence. More than domestic violence, it's really about safety in the workplace, at home, and also substance use at all of our mobile clinics. Most of the patients that we provide services on our migrant, like I said, they're male, although we do have families that come during the blueberries, but most of them are men. Our interventions on the mobile clinics are a little different, and that's why I broke it down between for our migrant patients versus our year-round patients. So our brief interventions tend to be more for our migrant populations, because we may see them once, and then we may never see them again, or they may come for a month. I have patients that come year after year to see me, but I might only see them for 2 months out of the year. So that is really challenging, because finding Spanish-speaking behavioral health providers across the state of Maine or across the country where they go is extremely challenging. So we work with lifestyle, like we'll do. So I'm not quite ready for the next one, but sorry about that. So we'll do lifestyle. We'll talk about lifestyle changes or behavioral modifications due to new or chronic or chronic conditions we had a patient that was traveling from Mexico, arrived to New Jersey and fainted. And then he discovered that he had diabetes, and it was very critical. And then he traveled here for apples. And so when he arrived here, I and the nurse met him to talk about diabetes and do diabetes education. And then he saw the medical provider who provided all the medications. So this is kind of what it looks like for us. We've seen a lot of increase in the last few years about wanting to talk about tobacco treatment. So tobacco treatment for us is free. We provide NRTs and we carry them on our units. And we're able to provide the treatment even when they leave and make the referrals for that.
Laura, 1 more minute. Thank
Sorry.
you. Wrap it up.
For our seasonal and year-round patients, it looks slightly different. It's more long-term. Some of the most common diagnoses that we see is PTSD, depression, anxiety. Our services are provided in our minivan that we have, and we travel to people's homes to provide those services, or we do it remotely. So I'm putting here a list of some of the resources that we provide, and there are services that can look like, and it's really about community and engagement and empowerment. And here are contact information for us.
Wow, Laura, that's amazing. And I know that some of the migrant workers also go to Vermont, and we really hope that if there's anybody here in Vermont, they can connect with you and with us. This is amazing. Thank you so much for letting us know about this program, really. And we hope to be continuing our work together, because we have lots of work to do. One interesting fact you show is you have Haitians as a farmer workers too. So that is another language. We need to start thinking about it, right? So
Absolutely, yes.
A lot of linguistic diversity among Latino communities. So thank you so much. And now we go back to Massachusetts, and it is my honor to present Christine Izarri. She's the director of the Impact Center. She works at the Gandara Center, and she will tell you more about that. But in addition to that, she is a Les Lead Fellow. She's one of the leaders of New England. She graduated from the academy with experience, and she is a leader in the Latino community. So it is my pleasure to welcome you, Christine, to talk about your community work. Thank you.
Thank you, Maria. It's always a pleasure of mine to join these activities and these meetings that you invite me to. I love to talk about my lived experience, the community I serve. So I am an agency in Massachusetts. I work for the Gandara Center. And today I'm going to be talking specifically about the home-based community services. We do provide additional services, but it would take me more than 10 minutes to talk about all the services that we do provide. But Gandara, can you, second slide, Maria? Yep. So another one. Yep. Gandara was founded in Springfield, Massachusetts in 1977 to advocate and provide services in a way of cultural competency for behavioral health in the Hispanic community. In around 1970s, we saw a lot of people coming, Hispanic migration coming to the area of Springfield, and had very limited services for mental health and substance use in their language. Not that there were none, but it was hard to find in a language that would fit their need. So our agency was named after Jose Gandara, who is a prominent physician and a public servant from Ponce, Puerto Rico. He dedicated his life to providing services for those who could not afford services. He advocated for urban renewals, and it was much, he advocated for public housing and many different things. Gandara embodies that in the mission and vision that we now serve. We have many different services throughout the state of Massachusetts. And I'm gonna, next slide, Maria. Okay, so Gandara delivers bilingual behavioral health services, substance use prevention services to a diverse clientele, nearly 1,500 children, adult and families, in over 100 locations throughout the state. One of the things that I didn't add on here is that we also recruit international candidates to match the population we are serving. And that is a big effort that our agency has put on, because we want to make sure that we provide specialty service to those who have in their language, their culture, and have similar backgrounds. In 2017, go back real quick. In 2017, there was a lawsuit, Rosie D versus Romney, and it compelled Massachusetts to provide intensive home-based services, and that's where we come from. So for that reason, the Commonwealth introduced intensive care coordination, in-home therapy, in-home behavioral, TM, and family support and training services. As of 2019 or 2009, Gandara has opened over 6 sites throughout the statewide that provide these specific services. Next slide. And I'm going to briefly talk about the services and what they are. If you have any questions, you can share them in the chat. So intensive care coordination is appropriate for youth and families who have complex and severe needs. The family with youth who have serious emotional disturbance. The intensive care coordination is a team of 2, usually is a care coordinator and a family partner. A family partner is a person who has lived experience, so they can support the caregiver. We help the families to create common goals that will support, them with their lifestyle and would enhance the child's stability. Next slide. And then in-home therapy meets the family for at least 2 hours, on a weekly basis. It's best for families who need more than traditional once a week therapy, because they go to your home and they work with the youth, but the family is very involved in the treatment. Sometimes in traditional therapy, you teach a youth one-on-one coping skills, but the family might not be aware of what the therapist is teaching the youth. In this way, the therapist will teach the family what techniques they're working with that young person, so everyone is in the same page and the youth can be successful. Go ahead, Maria, next slide. And then a therapeutic mentor works one-on-one, and it's a supportive relationship. It addresses daily living and social and community needs. It works individually with the youth. So the TM works in the home and outside in the community with this youth. And it is a very, very amazing service because they can teach the youth coping skills, social skills, and many other skills. And then the family support and training is a structured one-on-one relationship focused with the parent and caregiver, very similar to the family partner. The family support and training has lived experience, but the family might not need specific intensive care coordination, but they might need a family support and trainer. So this program assists the caregivers in navigating youth care, such as DCF, education, mental health, and other intensive needs that they might need. So this is a very supportive role. And a lot of our families really enjoy having a family support and trainer because they have lived experience and they can share that. So there's a mutuality there. And then I think I'm done. Yes. So that's all the services we provide. We do provide more. I'm not sure if Ingrid put our website on the chat. So you can look on our website, and there's a lot more information that you can search for. Thank you so much for having me, and I give it back to Maria.
Oh, Christine, thank you so much. And you covered so many aspects of Massachusetts. So this is it's a great resource for everybody. And as you can see, we have had so very different projects, really intentionally outreaching both Spanish-speaking and Portuguese-speaking communities. So let's all work together. This is how we call our strategy, Better Together. So I now open it up for questions and answers. We have, if you want to speak, you can definitely unmute yourself. You can put them on the chat. There's gonna be all the questions, the information of all the speakers are gonna be there, so you can contact and network together as well. So we have at the end a few housekeeping things that I will turn it over to Ingrid, but maybe if there's any burning questions, you guys can unmute yourselves. We have lots of people on the room, or you can raise your hand. Michelle Rivera, gracias. A very great work being done, but all organizations keep up the amazing work. Maybe perhaps all the presenters can put their emails on the chat so people know if they want to contact you. We need to work together. There's very few of us. We need to support each other through this work. Taylor, any comments?
Yeah, thank you so much. This has just been really incredible. And I'm so happy that these diversity inclusion project showcases are recorded, because we really want to show you off. And anytime that someone comes to us and say, we really want to increase our diversity among our organizations, do you know of anyone? Yes, absolutely. Heck yes, we've met incredible organizations today that we love to promote. My mind is blown with the woman empowerment work, the education that's being infused into community, the trust that is being built in your communities, right? That's the most important thing, so our messages can get across. And then we need to build trust with you as well. So we are taking the organizations that we met and really making sure that you have all the tools you need to be successful. I will share just one opportunity while I have a little bit of time. I know Christine graduated from her leadership program. She's incredible. There's another one that NIH has, the 2023 National Hispanic and Latino Executive Leadership Program. The program focuses on leadership capacity building, offering behavioral health leaders the opportunity to discover and expand their leadership strengths. And so I'm going to put a link in the chat just to share that opportunity with each of you. And as I think of more, I'll continue, but I'm honored to meet you all. And I'm just so grateful for the work that you're doing. It was addressed that anxiety, stress, and depression permeates through our communities. And there's not a lot of space to talk about it in our languages in a way that people understand. And we're also dealing with NIMBYism, right? People don't want always to see our organizations treating each other in their backyards, but we are here to stay. Mental health is being elevated, and we will no longer stand for the discrimination that it is. So I'm honored that you are doing this work in the field. Thank you so very much, Maria. This was absolutely incredible. And I promise to keep on working on my Spanish.